Hello, my name is Charlotte Cunningham, and today I am going to be presenting my research experimenting with kefir to improve nutrition and quality of life for persons with dysphagia worldwide. If you have any questions regarding my work, please make sure to contact me through my email at charlotte.glohea@gmail.com. Before we get started, I would like to give you some biographical information. I am a rising sophomore at Washington Liberty High School in Arlington, Virginia. When I am not focusing on my classes, I am actively involved in clubs and activities based in my school and in my community, such as the Red Cross Club, the Arlington Youth Philanthropy Initiative, and cross country and track. As for my interest in science, I'm involved in science fair competitions and research paper symposiums, such as the Virginia Junior Academy of Science. Glohea is my first step into the area of global health, which is an emerging interest of mine. This fall, I hope to introduce a chapter of Glohea to my school. My career goal is to travel the world, write scientific papers, and study medicine concerning infants and young children. I am currently interested in learning about obtaining an MD, PhD, or an academic program that combines medicine, research, and business. I am now going to share my research. In order to discuss my research, I need to define an important word. What is dysphagia? This is a medical condition where persons have difficulty swallowing food and drink without aspiration or choking because their head and neck muscles have been affected by some condition or injury. Causes include stroke, cerebral palsy, birth defects, ALS, and many other nervous system diseases. It mainly affects the elderly population, but not exclusively. Why is it important to global health? Dysphagia is incredibly important to global health because this condition prevents persons from receiving adequate nutrition and hydration. Improper swallowing and eating causes aspiration and choking, which negatively impact a person's quality of life. Millions of people in the world have dysphagia. Worldwide, it is about 8% of the population, and in the US, it is about 5.5% of the population. As the world population ages, dysphagia is expected to become a more prevalent condition. Why study Kefir? 2 summers ago, I attended a medical camp at my local hospital. While on a tour of the facilities, I met occupational therapists who demonstrated how they thicken liquids for patients with dysphagia. The product they used was the powder thicket, which is mainly cornstarch. However, there are several drawbacks to using thicket, such as lack of added nutrition, such as vitamins and minerals, unpleasant consistency, and it tends to over-thicken beverages over time. Later, this camp experience allowed me to connect with a speech pathologist, Ann Hancock, who later became my mentor. Here's a quote from Ms. Hancock. In it, she is sharing a main problem people in her profession have while trying to help patients with dysphagia. Both patients and speech pathologists experience a major struggle in determining an adequate as well as a beneficial liquid substitute for patients to consume as they try to balance safety, hydration and nutrition, and quality of life. Patients share that they consume less fluids if they are thickened because they can dislike the new consistency or feel fuller sooner and become less hydrated as a result. I became interested about a solution and began thinking of an improved way for persons with dysphagia to be able to choose which nutritional liquid is right for them. I then decided to focus on kefir, a fermented milk beverage created by bacteria and yeast. It has an improved consistency, offers a lot of nutrition such as potassium, calcium, magnesium, phosphorus, some microelements, and is lactose-free. I then decided to test kefir based on the IDSI framework in order to see if it could match up to the most commonly needed levels of 2, which is mildly thick, and 3, which is moderately thick. Imagine your favorite cup of coffee, but on the right, someone has added thickener to it, so the texture has changed. This emoji illustrates the reaction many dysphagia patients have to their favorite cup of coffee needing to be altered so they can drink it safely. An improved method to measure thickness. I wondered if kefir were a thickness that could be helpful for dysphagia patients, and I set out to try to measure its thickness. I used a baster tool to measure the flow time to see if it significantly varied by type of milk fat. I studied kefir of various milk fat percentages. While I was able to document differences with the milk fat differences, I wasn't satisfied with the precision or with the method, so I kept looking. In my research, I came across a new framework. I then discovered the IDSI framework, which I wondered if it could solve my problem. The International Dysphagia Diet Standardization Initiative, or IDSI, created a standardized method for measuring food and drink thickness. This has been in existence since 2015. The old system classifies thickness into 3 categories. Did it look nectar thick? Did it look honey thick? Did it look pudding thick? This system led to lots of confusion. In this system, you use a 10 milliliter syringe to get 10 milliliters of kefir out of for 10 seconds. The amount of leftover liquid, if any, corresponds to a thickness level. The more liquid that remains in the syringe, the higher the IDSI thickness level. Last year, my research investigated which IDSI levels various commercial kefir brands corresponded to. I couldn't find any previous studies that did this work, so I decided to do my own experiment. The commercial kefirs I studied match up to the IDSI levels 2 and 3. Interestingly enough, these are the most common levels of thickness required by patients. I would like to expand my research to determine which commercial kefir is correct for persons with dysphagia to consume based on the liquid thickness they require. My future studies involve looking into more commercial kefirs, determining their IDSI thickness levels, and helping persons with dysphagia find which drink is best for them, which will improve many factors. During my sophomore year at high school, I plan to work determining if the thickness of kefir increases thickness over time. In other words, I'm going to further study the effects of time and temperature on kefir. Here you can find a list of the websites I went to for information. There are many people who have provided me with so much help throughout my research project, and I would like to give them recognition. I would first like to give a huge thank you to those at my local hospital, Virginia Hospital Center, for the support and information. This includes my mentor, Ann Hancock, for guiding me through the experiment. I would also like to thank the other professionals at the hospital for supporting me, such as Andrew Malone, a nutritionist, and Kelly Arlen, the director of ChemEd, who put me in contact with my mentor. From my high school, I would like to thank my science teacher, Mrs. Sotomayor, for the recommendation to the Global Health Leaders Conference. I would like to thank Glohea for providing this wonderful opportunity and continuous ways to promote global health at this time, especially Siam for supportive communications. And lastly, I would like to thank my family for supporting my curiosity and interest in science and global health.